all countries across the world are low resource when it comes to mental health care. If we have to kind of change this in some way and increase access to care, then we have to be creative. And task sharing is just one example of how we can be creative about providing mental health care. The prevalence of depression across the world is not much different, right? And whether it's India or any other part of the world, and within India, whether it's Goa or other parts, it's a substantial problem in the communities, and more so in primary healthcare settings. People don't get identified as having depression because no one asks them those appropriate questions. Because they don't get identified, they don't get treated. If this turns out to be effective, what we are telling the rest of the world is it's possible to train people in the health system who are doing a lot of other things to also provide counseling for depression. There's a long-standing relationship and collaboration between the two institutions, the London School and Sangath, for more than 20 years now. And I don't say this very lightly. A lot of the very groundbreaking work and seminal work that has happened within the global mental health space, especially in terms of understanding mental health in low-resource settings and in developing and testing interventions to increase access to care, has come out as a result of the collaboration between the two institutions. So in some sense, these two institutions have been at the forefront of the global mental health movement. We can't say anymore that we don't know what works. We have enough evidence. We have to now move on to making it work. Impress is just one example of that.
हांव अशें सद्दां बरें नासतालें, परत बरें नासतालें, अशें वीक पडटालें हांव सदांच आनी अशें टेंशन खूब जातालें. टेंशन खूब जावन सद्दां हांव अशें बरें नासता. आठवड्याक 2 टायम म्हाका डॉक्टरागेर वचचें पडटालें आनी अशें सद्दां बरें नासता. त्या खातीर हांव डॉक्टरागेर वयतालें. मागीर तेन्ना म्हाका ID हॉस्पिटलान सिस्टर मेळ्ळी पळय, कावन्सिलींग ती करता ती मेळ्ळी म्हाका आनी तिणें विचारलें, तूं जें कावन्सिलींग घेतलें तूं रेडी आसा काय म्हणून. मागीर हांवें हय म्हटलें.
So what we're trying to do in Impress is on the one hand, reduce the supply side barrier, which is we are making a psychological and evidence-based low-intensity psychological intervention for depression called the Healthy Activity Program, available across all of the public sector health centers in Goa. What we have done is to train existing healthcare workers from within the health system to deliver the intervention.
I'm Dr. Shweta. We get patients through our screener. So then she would tell me about some physical problems, like I have diabetes, I have chest pain, or I have headache. But gradually when we tell her that we are also here to help you to understand that sometimes a mental stress can lead to physical unfitness. You feel that there is something which is bothering you mentally, or there is any tension which you have. That's where the patient says, yes, I have ABCD issue. Then we ask them some 9 questions, which is called as PHQ9, in which those questions tell us about how is their mental state. They are telling us about their situations of life, which is making them depressed. So then as a part of depression, we go through the sessions in which we tell them how to come out from depressions through breathing techniques, or making them feel good with regaining the previous concepts of HAP. What are the activities that make you feel good and that you need to continue to stay well?
Gardening,
Barobar, sarke.
planting vegetables.
Oh, yeah. As we have moved ahead in this process, you have seen that by doing the simple techniques, which unknowingly I have told you, do this as a hobby, start implementing things which you feel good. And once you have started doing that, your PHQ9 has dropped with your depression level. When you had come on day 1, PHQ9 was very high. मी तुका म्हटलेलें आहे, तुझी mind state खूप stressful असा, depressive असा. But now today we are on session 5. आणि आज आम्ही PHQ9 पळयलं तर it is 3. The solutions work. And they feel more confident that yes, wow, that solution which you told me. And I say that no, it's not me who I have told, it's you who have made that solution. You have implemented that solution. We just worked it out and the answer has come. Okay.
मागीर तुमकां अशें टेंशन जाता तेन्ना मॅडमीन सांगलें तें कावन्सिलिंगाचे मॅडमीन तुमकां कसलें कसलें टेंशन आसा तेन्ना तुमी गार्डनान वचून बसप, गार्डनान झाडां रोय, तुका आवडटा काय विचारलें झाडां रोवपाक. हांवें म्हटलें आवडटा, झाडां रोवपाक म्हाका आवडटा म्हटलें, काम घरांतलें करपाक आवडटा, घर क्लीन करपाक आवडटा, चड करून म्हटलें म्हाका झाडां रोवपाक आवडटा. ती खूब बरी आसली, तिणी म्हाजें सगळें मनांतलें विचरून घेवन खूब बरे तरेन म्हाजें तेणी कावन्सिलींग घेतलें आनी तेका लागून म्हाका आनी खूब बरें दिसलें. मनांतलें म्हाजें अशें तकलेवलें टेंशन खूब पयस जालें.
So that's one side of the problem that we're trying to solve. That's the supply. What we're trying to do with Impress is seeing if we can improve the outcomes that we can get with these psychological interventions through supplementing it with a community intervention, which allows us to increase awareness about depression, to engage people in treatment and complete treatment.
My name is Miriam Sequeira. I'm the intervention lead at the Addictions and Related Research Group at Sangath. On this project, I supervise the community intervention. So what the community volunteer does is that they create awareness about depression in their communities. They tell people what depression is, what it looks like, and if they identify that, where to go and seek help, which is at the primary healthcare facilities. There is a counselor, how to access that help, and they also provide support to those who start accessing help and motivate them to complete their treatment. So this awareness activity that is planned today is embedded within an existing meeting. So this is a self-help group, what we call. It's tied to an financial scheme that the government is running, trying to make women empowered by doing small little microfinance jobs. So these women will gather here, and the community volunteer is going to use that meeting to use our banner as part of our toolkit, which we've given to her, and some brochures which she's going to distribute. And all of this contains signs and symptoms of depression, information about counseling, and where to access it. And she's going to talk about that and have a couple of games to keep the mood light.
सो म्हाका दिसता सगळ्यांत चड नुस्त्याची नांवां कोण घेता पळय ताका प्रायज मेळटलें.
The community volunteers and Sangathis, as we call them, do lots of things to increase awareness and reduce stigma. They do various different awareness building activities in the communities, either ones that they organize themselves, like street plays to build awareness, or they layer on the awareness building activities onto activities that happen in any case within the communities, such as, religious events, etc.
Pleasure to have you here with us.
My name is Shirley Albert Dias. I work as a Sangathi. I am a good listener. My first point is I am a good listener, and I like to interact with people. We Sangath are there for them. We did awareness on Sangath and Impress so that people who came new today, they could be aware of it and they could speak to others, and we could have more people who would come forward to tell their grievances and their mental stress, and so we could help them in future. This play helped to explain in a better way. First we used to only talk, but in reality when we acted, people would understand more better. That's why I felt this play was really helpful for them. And some of them said, yes ma'am, we are also having some problem. We could understand what you all are doing. It's really like good work you all are doing. We appreciate, and we could like to meet you for their problems are there. They said they were going to meet me.
So in this way, we in Impress, we are trying to solve both sides of the problem. We are making the service available, but we are also ensuring that people know about it, come to it, access it, and complete the treatment. If this turns out to be effective, what we are telling the rest of the world is it's possible to train people in the health system who are doing a lot of other things to also provide counseling for depression. Same model, which is non-specialist workers, Same intervention, which is the healthy activity program, which was developed and tested here in Goa, is now being delivered in Texas through church pastors. So they have been trained to deliver this depression intervention. The earlier understanding was, these are interventions are for low and middle income countries, but they translate to any country where there is a gap.